Hello and welcome to CATEX-TV. I'm Tom Bailey in London. It's 4:30 PM in London, 11:30 Eastern Time and 12:30 in Bermuda. Today in history. On the 5th of November 1605, a plot was uncovered whereby a number of Catholic conspirators, including Guy Fawkes, attempted to blow up the British Houses of Parliament. This has since been known as the Gunpowder Plot. It was a failed assassination attempt by a group of provincial English Catholics against King James I of England. The plot intended to kill the king and most of the Protestant aristocracy by blowing up the Houses of Parliament during the state opening on the 5th of November 1605. The conspirators also planned to abduct the royal children and lead a popular revolt in the Midlands. The conspiracy was uncovered a matter of hours before it was due to take place, and the gunpowder was already in place beneath the chamber where the king was to sit. The subsequent trial of the conspirators ranked highly as a public spectacle, and there are records of up to 10 shillings being paid for entry to the trial. 4 of the plotters were executed in St Paul's Churchyard on the 30th of January 1606. On the 31st of January, Guy Fawkes, Thomas Winter and a number of others implicated in the conspiracy were taken to Old Palace Yard in Westminster in front of the scene of the intended crime, where they were to be hanged, drawn and quartered. This was a grisly form of execution where the condemned would be dragged on a wooden frame to the place of execution, hanged by the neck for a short time or until almost dead, disemboweled and emasculated, and the genitalia and entrails burned before the condemned's eyes, and finally the body divided into 4 parts and then beheaded. Fawkes, although weakened by torture, cheated the executioners. When he was to be hanged until almost dead, he jumped from the gallows, breaking his neck, killing himself, thus avoiding the gruesome latter part of this execution. Guy Fawkes Night is an annual celebration of the evening on the 5th of November, marking the downfall of the Gunpowder Plot. It's primarily marked in the United Kingdom, where it was compulsory by law until 1859 to celebrate the deliverance of the King of Great Britain, but is also celebrated in former colonies including Bermuda. Typically people let off fireworks, light bonfires where an effigy of Guy Fawkes is burnt on top of the bonfire. And now to the news. Scientists in Africa have begun trials of a malaria vaccine which, if successful, could save millions of lives in the continent and around the world. Developed through 2 decades of research, the Mosquirix vaccine, also known as RTSS, is being tested in Africa's biggest ever clinical trial, spanning 7 nations and involving some 16,000 children. More than 5,000 children have already undergone preliminary trials since testing began in 2003. Mosquirix is the first malarial shot to make it to the final stage trials and has generated huge interest ahead of a conference of 1,500 malaria experts to be held in Nairobi next week. According to the World Health Organization, malaria kills about 1 million people each year, mostly children in Africa under the age of 5, while around 40% of the world's population, mainly in the poorest countries, are at risk of the disease. The vaccine is the result of a partnership between GlaxoSmithKline, the British drug manufacturer, and US-based Path Malaria Vaccine Initiative, an anti-malarial charity funded by the Bill and Melinda Gates Foundation, along with clinics and research centres in Africa. Dr. Samuel Kariuki, the Deputy Chief Researcher in the vaccine trials, said, "We expect this vaccine will have a tremendous effect in the reduction of the number of admissions we see in the hospital and the number of deaths that occur due to malaria, especially in young children." Data from earlier trials of the vaccine suggested that it's 50 to 55% effective, but is likely to take another 3 to 5 years before it's licensed and put into use if it works. Dr. Salim Abdullah, a malaria expert with the Tanzania-based Health Institute, said that getting promising results would be a major breakthrough which could see the production of the first malaria vaccine within 5 years. He said earlier trial results have shown that the vaccine can reduce the risk of malaria in children by up to 50% and similarly reduce severe consequences of the disease, which could save millions of lives in Africa. GlaxoSmithKline, the pharmaceutical company behind the trials, said it was committed to delivering the vaccine at a reasonable price, accessible to those who most needed it. Andrew Whitty, the company's chief executive, told reporters last week that we are not going to let price get in the way of access for malaria vaccines. We will be extremely responsible about the way we price this vaccine. The final stage tests are being conducted in Burkina Faso, Gabon, Ghana, Kenya, Malawi, Mozambique and Tanzania. Experts say that to be the most effective, the vaccine would still have to be used along with other preventative measures like mosquito nets and insecticides to save lives. This news has sort of growing pertinence for European and North American populations as climate change is seeing the ever northwards spread of the malaria-carrying mosquitoes. The Netherlands yesterday reported its first case of drug-resistant swine flu, but said there was no reason for panic. According to health sources, a patient with serious flu symptoms turned out to be infected with an H1N1 virus that is resistant to the antiviral drug oseltamivir, also known as Tamiflu. The statement continued, "This is the first time that a Tamiflu-resistant H1N1 virus has been found in the Netherlands." Jessica Grutenboer, an official at the institute, told the press that the drug-resistant strains of the virus do not spread quickly, and that the patient was under close monitoring in hospital. She continued, "There is absolutely no reason for panic." The World Health Organization has reported 39 drug-resistant cases worldwide to date. In September, the WHO said antiviral drugs like Tamiflu shouldn't be used to prevent swine flu, as this practice had caused almost half of the known cases of drug resistance. 10 people have died of the H1N1 virus in what authorities have described as light epidemic in the Netherlands. Annually, about 1,000 people in the country die of the ordinary seasonal flu. The WHO said that more than 5,700 people worldwide have died of swine flu since the virus was first detected in April of this year. Now we've got some tropical storm news for you. There is tropical storm developing in the southwestern Caribbean Sea. It's quite late in the season, but tropical storm IDE, with sustained winds of 60 knots, is currently tracking north-northwest and is expected to hit the resort of Cancun. We'll keep you updated on this as it develops and with any further news of any other expected landfalls after it clears the Cancun Peninsula. Broking group Willis has unveiled plans to expand its broker network, Willis Commercial Networks, around the world. Willis has appointed Mark Radburn as Chief Executive of Willis Networks International to oversee the expansion. Radburn, who has developed and led Willis Networks for 7 years, will report to Sarah Tuville, Chief Executive of Willis International. Phil Scarrett, currently Managing Director of Willis UK and Ireland's commercial business, will succeed Radburn as Managing Director of Willis Network in the UK and will continue to report to UK and Ireland Chief Executive Brendan McManus. The Willis Network was established in the UK in 1999 and is comprised of Willis Commercial Network, representing more than 81 regional brokers who place in excess of £350 million of premium, and Willis N2, which represents 21 smaller community-placed brokers who place around £50 million of premium. Members of the Willis Network receive technical and sales training from Willis, as well as strategic marketing, compliance, business development and sales support, along with, most importantly, access to Willis's global placement and industry sources. McManus said the key to success of Willis Network has been the independence of its members and their access to our strong trading relations with leading insurers, cutting-edge technology and business support and training services. He said that we believe that the name we have created for our network in the UK will resonate in other markets around the world and have appointed Mark to lead the initial charge into Europe and Latin America. The UK network remains the jewel in our crown, and Phil's experience will help us to reach our goals of growing the Willis Commercial Network to 100 members and Willis N2 to 120 members by 2011. We've got some other reports of numbers in. So Bermuda reinsurer Montpellier Re Holdings posted third quarter net income of $148 million on strong underwriting results and gains in the value of investments. The result was a spectacular rebound from last year, where the reinsurer made a loss of $142 million in a quarter impacted by hurricanes Ike and Gustav and treacherous financial markets. Realized and unrealized gains on investment and